Good morning, everyone. So, today we will be presenting an analysis of operational efficiency and patient outcomes at Alberta Regional Hospitals. So, our group members are Kanika, Harvinder, Zinu, and Yashas. Moving to the next slide. As healthcare system face growing pressure, hospitals must balance increasing patient demand with limited staffing and resources. When staffing is misaligned, both efficiency and clinical outcomes can suffer. So in this project, we explained how staff morale, patient satisfaction, and service demand interact across different hospital departments. We use integrated data sets to uncover underlying patterns that may not be easily seen when the data is viewed separately. So by visualizing these relationships, the study aims to provide insights that can support more effective and operational decisions. Going forward to the next slide. So in this project, our first objective was to investigate how staffing levels, scheduling patterns, and service demand influence both patient satisfaction and hospital efficiency. We also aim to identify service areas where mismatches can exist between bed availability and patient admissions. Since these gaps directly affect patient experience, another key focus was exploring the correlation between staff morale and patient outcomes, recognizing that the well being of staff often translates into the quality of care delivered. Finally, the project is designed to provide actionable recommendations for hospital administrators, helping them optimize resource allocation and improve overall care quality. To begin the analysis, all the datasets were cleaned and standardized to ensure accuracy and consistency. Staff, patient, and service tables were then joined using shared keys such as service type and dates. From this combined dataset, we calculated key metrics including average satisfaction levels, morale scores, and the difference between patient demand and available bed capacity. All the visualizations were created in Tableau, which allowed for deeper analysis throughout the process. The results were checked for reliability to ensure that the insights were meaningful for real-world hospital operations.
Here is the main dashboard created for this project. It represents multiple indicators in one view, indicating patient satisfaction, staff morale, demand gaps, and monthly trends, as well as the service comparison efficiency versus the absence. So the interactive filters allow users to compare services and months easily, making it practical for decision makers. By combining several charts together, the dashboard provides a holistic view of operational performance. So this setup makes it easier to identify problem areas and understand how different factors connect to each other. Overall, the dashboard displays service efficiency, morale, demand gaps, and the trends as I mentioned earlier, while highlighting key efficiency issues that affect patients' experience. It supports administrators with quick, intuitive insights, making it as a powerful tool for guiding hospital operations. Comes to surveys comparison regarding efficiency versus absence. This comparison highlights key operational contrasts across services. Emergency shows the highest efficiency, but its critical absence ratio of 39.92 threatens service stability. General medicine stands out for strong patient satisfaction at a rate of 81.23, though its efficiency and absence are moderate. ICU delivers the best overall balance, high efficiency, lowest absence, and top satisfaction, making it a benchmark for integrated performance. Surgery maintains moderate metrics but faces the most severe bed shortages, indicating resource strain. So the overall ICU's model is worth replicating, while emergency urgently needs HR and scheduling support. The second chart compares available beds with the number of patients admitted across services. It immediately shows which departments are under the most pressure. Whenever we see a negative values, it means patient demand is higher than the available bed capacity. So the ICU and emergency departments stand out as consistently exceeding capacity, and this suggests that these areas may require additional resources or a redesign of patient flow to better manage the demand. Understanding these gaps is crucial crucial for improving wait times and the patient experience.
Hi, so this chart looks at the average staff morale across the different hospital services. Overall, it seems stable, but there are some differences. The emergency and general medicine staff appears to have slightly higher morale level, whereas the ICU, however, shows the lowest morale, which aligns with the capacity pressure we saw earlier. This pattern suggests that workload intensity may be affecting staff well-being. Monitoring morale is important because it often influences patient outcomes and team performances. Moving forward, here we can see the average patient satisfaction for each service. General medicine has the highest satisfaction, which may reflect lighter workloads or more routine care. Emergency and surgery show moderate but consistent satisfaction scores, but whereas ICU satisfaction is slightly lower, which again aligns with the earlier findings related to high demand and low morale. While these results highlight how operational pressure can directly influence a patient's experience. Moving forward, this line chart here shows monthly trends for both staff morale and patient satisfaction. We can see that satisfaction tends to dip during months when morale decreases, particularly around mid-year. Later in that year, when morale rises, satisfaction also improves. This pattern shows the connection between staff well-being, and patient outcomes. This highlights the importance of maintaining stable staffing levels, fair workloads, and supportive work environments to deliver better care and higher satisfaction.
Let's move to our next slide, the scatter plot slide. We show the relationship between the staff morale and patient satisfaction. In the visualization, the patient satisfaction is more important. Each point represents a specific time period across the year. What we immediately notice is a journal uptrend, meaning that the morale increases and the patient satisfaction tend to increase as well. There are several clusters of points where high morale clearly align with the better satisfaction scores. On the other hand, the points with lower morale value are the ones we notice the lower patient satisfaction. This suggests that the staff experience, whether they feel supportive or not overworked and emotionally stable, directly influence how the patient read their hospital experience. At the same time, we can see the minor spread in the plot, but overall the strong positive pattern reinforce that um, improving staff well-being can meaningful improve the patient outcomes. Let's move to our findings. First, the staffing gaps are creating the instability in the high demand area. For example, the emergency department show the extremely high absence rate despite the high efficiency, which means that the staff are overworked and stretched thin. Second, the ICU set the benchmark. It has strong efficiency, low absence rate, and consistent high satisfaction. They show that what balanced staffing and resources can be achieved. Um, Next is the hospital face the significant bed capacity mismatch. Emergency and ICU departments often operate the fewer available beds that can be the number of patients admitted, which contribute to delay and overcrowding and stress on both the staff and patient. Our fourth is the morale and satisfaction are connected, and a trend show that the both line chart are the earlier and scatter plot here. When morale drop, the patient satisfaction drop with it. Highlight the need for supportive staffing policies. And finally, each service area behaves differently. Emergency, ICU, surgeries, and general medicine face the unique challenges, meaning a journal policy would not fix it everything. So targeted department specific strategy are needed. Based on our findings, here are the recommendations that we can suggest to improve the hospital operation and patient outcomes. First is the address staffing gaps through smarter scheduling and workload distribution. Second is the use of ICU's model as a reference. It balance between the staff and bed and patient flow can guide how other departments structure their resources. And next is the third one, improve bed capacity planning. Hospitals can reallocate the beds during the peak times and adjust admissions protocols to avoid the demand supplies mismatch that leads to overcrowding. Fourth is the investment in staff wellness initiatives. Even small improvements like recognizing high performance period, provide the mental health support, or offering more flexibility schedule can boost their morale and improve the patient. Last but not the least is the implement department specific improvement. Emergency may need the scheduling changes. Surgery may need better resources allocation, and general medicine may need strategies to maintain their existing satisfaction level. Trailing such solution ensure that the department improve without disruptive others. Overall, these recommendations aim to improve the operational efficiency, staff experience, and patient satisfaction stimulation, creating a more balanced and effective healthcare department. Thank you so much for listening us.